We're incredibly excited to spend time with you today, and we have an amazing panel assembled, and they will talk about the sense of belonging and the reasons they chose University of Chicago. With us and leading our panel discussion, we have our two directors of diversity, engagement, and inclusion, Dr. Stephen Estime and Dr. Edwin McDonald. Dr. Stephen Estime is an associate professor of anesthesia and critical care at University of Chicago. He completed residency right here with us at University of Chicago, and then completed a critical care fellowship at the Brigham and Women's in Boston. His academic work and interests include his work in the trauma surgical ICU, which includes quality improvement, patient safety, and health equity. As I mentioned, he serves as a co-director for diversity, engagement, and inclusion in graduate medical education, and he really is an integral part in linking the pathway from undergraduate medical education to graduate medical education, and then retaining our talented residents and fellows as faculty at University of Chicago. We also have Dr. Edwin McDonald. He's dedicated to improving the health of individuals and in communities through nutrition education. He is not only a gastroenterologist, but actually he wears many hats. He got his interest in studying and working to improve social determinants of health in his work that he did with Project Brotherhood. For those of you who know of the project, it's an innovative clinic dedicated to providing accessible, affordable care for Black men on the South Side of Chicago. While training barbers to serve as health educators, he became keenly aware of the social determinants of health. Again, he is not only a gastroenterologist, but he is also a trained chef, clinician, educator, and researcher. His research has been funded by the National Institute of Diabetes and Digestive and Kidney Disease. And again, I'm Anita Blanchard, the Associate Dean for Graduate Medical Education, and I'll now turn the discussion over to Ed and Stephen.
Anita, thank you so much for that wonderful introduction.
Thank you.
All of our panelists on here today for taking time out of what would otherwise be, I'm sure, a wonderful and relaxing Sunday to spend it here with us, discussing about, University of Chicago and all things related. So I'd like to go through the room and let everybody introduce themselves. Perhaps tell us your name, the department that you represent, and your role within that said department. So why don't we just go with those that I see on my screen in order. So I'll start with you, Dr. Villamar. Would you mind starting us off?
Sure. So my name is Dario. I'm one of the first-year adult hem-onc fellows at the University of Chicago. I did my medical school and residency at New York Presbyterian Hospital, Cornell in Manhattan, and was happy to come back to the University of Chicago as I did my undergrad here. I kind of spent some time in New York and really was active in LMSA as well. We hosted some of the regional conferences and participated in the national conferences as well. So I'm very happy to participate in this panel. As far as my experience so far at the University of Chicago, I am doing kind of a lot of clinical work, mostly as a first-year fellow would do. And I'm interested in the next 2 years in terms of my research in the area of health disparities as it particularly relates to cancer patient populations, things like improving clinical trial participation in this group and screening methodologies and kind of how to improve our numbers in those areas. So happy to be here, which I know is a great place to get that type of training.
Thank you for that. Next on my list, or next on my screen rather, I see Dr. Kelly Pointer. Would you mind introducing yourself?
I'm Kelly. I am currently in my 4th year of residency in the radiation oncology department. I initially did my medical school and PhD in the joint MD PhD program at University of Wisconsin. I lived in Boston for a little bit, Wisconsin, but I'm originally from the Chicago area, so I was really happy to find a place that was back close to home. In terms of I guess what I'm doing now, I'm in a research track program called the Holman Pathway. So it allows me to do a combination of research and clinical time. So I get some extra protected research time, which a lot of programs don't allow in radiation oncology. So that's another great opportunity that I have had in terms of coming to the University of Chicago.
Perfect. Thank you for that pointer. Next, I'll go with Dr. Naylor.
Hi, I'm Rochelle Naylor. I'm one of the pediatric endocrinologists, so I'm happy to be on the panel with Maria. But I also am one of the associate program directors for our pediatrics training program. I've actually been at the University of Chicago for all of my training after medical school, so since 2005. It's a wonderful place, I think, to train. I'm, delighted to be a part of our training program because I think we have the most awesome trainees. And it's also a wonderful environment to do research in, and I'm, pleased with all of my colleagues, and I'm happy to answer questions as we go through the panel.
Perfect. Thank you, Dr. Naylor. The next I've got Maria next on there.
Yeah. Hi, I'm Maria Salguero. I'm a pediatric endocrinology fellow at the University of Chicago. I'm in my third year. Very fortunate to be here. Also happy to see Dr. Naylor here. And we have great residents. We have great medical students, and our pediatric endo group is very diverse, and I have learned a lot during my fellowship here. So very, very, very happy being trained here. I did medical school in Colombia, South America, and then I did a master's in science in Boston, and then I was fortunate to also I did my residency in Texas. But my family, we wanted to be close to family. My husband is from here, and University of Chicago was my first option, and I'm very happy then that I was blessed to get into University of Chicago.
We're happy to have you. Thank you for coming to the panel. Last but not least, Dr. Romero. Just as a primer, we're just introducing our name, our department, and sort of our role within the department/institution.
Great, thank you. My name's Iris Romero, or for this crowd, Edis Romero. I'm a professor in the Department of OBGYN, and I'm the Dean for Diversity and Inclusion for the division. Glad to be here.
Glad to have you. So I wanted to first kick things off. And obviously we've all come from very different places, but we're all here at the University of Chicago now. And so I'm really interested in how you chose to arrive, or how you chose to come to the University of Chicago, particularly when there are a lot of other great institutions in our own backyard, in the city, and then throughout the country as well too. So with that in mind, I'm going to open it up to the group in no specific order. Anybody that wants to tackle this can tackle that question. But yeah, why the University of Chicago, as opposed to all the other great institutions, without necessarily naming any specific names? But why the University of Chicago?
I'm happy to start because I will say I couples matched for residency. My husband was going into internal medicine, and I grew up in Arizona, so admittedly, and I was in the Midwest at the time, as was he. He put the University of Chicago on our list. All of my programs had lots, more sun and less snow. And I remember thinking, like, I was at a Midwest program, he was at a different Midwest program. It's like, why would we, meet in the middle? But I came, and like legit on my interview day, called him to be like, we are coming here. And he knows I can get excited and carried away. I don't think he put much stock in it, but I kept coming back to it. We're coming here. And for me, it was the people I met that day. Like I knew instantly, I was like, I will be at home here. Like these are my people. Even though it won't be these exact same people who are sitting here today, like we are like-minded in the sense of why we're going into medicine, the type of patients we want to serve. And I knew, I was like, these people are going to not only have my back, but they're going to push me to do my best. And I'm going to want to have their back and do the same for them. I've never been wrong about that. And the other thing for me was the patient population. We have an amazing patient population on the south side of Chicago. They face a lot of structural inequities that impact their health, and being able to care for them is an extreme privilege, keeps me connected to my mission when everything else is going a little bit wrong, right? Reminds me why I wanted to be a doctor in the first place. So on my, sort of worst day, when I interact with a patient, I'm back to realizing the privilege that I have, and so for me, that was it. Even though I had initially like no desire, I was like, no, more snow. And I will say I love Chicago, which at the time I didn't realize I would, but I love Chicago. The summers are worth getting through the winters.
Thank you for that. I'll say that it's I completely hear you with that. I always say that Chicago is the best city in America in the summer. The winter's a little bit struggle, but for those summers, it's completely worth it. So, sorry, Dario, I think you were gonna say something.
No worries. Yeah, so I would say I had a few reasons for wanting to come to Chicago and the University of Chicago. So I have family who live like an hour away, and I had been away from them for a little bit. I was born in Ecuador and grew up in South Florida, but then we eventually kind of moved to the Chicago area and kind of settled here for what's home. In terms of why I wanted to come to the University of Chicago, I really liked the kind of culture of supporting diversity and inclusion, and that's something that's really reflected in the trainees, the medical students, and faculty, as well as the patients we serve, all within a great academic center where you have a ton of research opportunities. In my field in oncology, I really liked the breadth of things that we could do, and kind of the number of people there were to mentor us, which I think is really, really important. I think the other plus side is that it's part of the university campus, and that gives you a lot of opportunities to interact with people from some of the other schools, and that you wouldn't really have at a kind of a standalone kind of medical center. So for us, I know we have opportunities to get additional training, and whether it's through getting a master's program or a certificate in things like outcomes research training, or ethics, and kind of masters in like clinical science investigation. So I think those opportunities are all great and kind of all come together nicely at the University of Chicago in an environment that really is supportive and helpful to your development as a physician.
Thank you for that.
Yeah, I would agree with everything that's been said so far. I knew that when I was looking for a place for residency, I wanted to go to a hospital that had and served the community, and worked with some underprivileged populations. And I think University of Chicago has this unique balance where we get to serve the south side of Chicago that has some underprivileged populations, but we also are a tertiary center, and so we also get to see a lot of people that fly in from other places for second and third opinions too, and so you get a nice combination of both. And the University of Chicago really does put in resources to support the community, which can't be said for all places, which was really attractive to me. And then I am from Chicago area, but I wasn't necessarily sold on coming back here. But when I came to the department, I fell in love, and kind of on a more like personal note. I knew I was single when I was looking for a place to go to residency, and so I knew I wanted to be in a larger city. I found my husband here. It's a great place, lots of social activities. So not only is the university great, the city's also great.
I agree with that. I found my wife here as well too. So yes, it is definitely a place where you can find your long lost love. Thanks. I think one of the one of the common themes that I've heard everybody sort of touch upon is really the community and the patients that we serve. And for myself, I think that was one of the biggest differentiators that allowed me to not only choose University of Chicago as a trainee when I was a resident. I did leave for a little bit as a fellow, but then ultimately I came back as an attending for that very reason. And actually, interestingly enough, when I did my fellowship I was in Boston and I worked there for about a year and a half as an attending. That was actually a really noticeable difference. Was the kind of work in Boston I was doing was not on the patient population was not primarily underserved. It was primarily people that were well insured. They all knew their medications. They all got regular follow-ups with their physicians. It made my job a lot easier from an anesthesia standpoint. But I did not really feel like I was making a huge impact on those individuals' lives because I knew that they had the luxury and they had the resources to really get their care anywhere. They didn't necessarily need to come to me or my institution to get it done. But when I was a resident and now that I've come back as an attending, I really do feel that the University of Chicago, the patient population, because of the fact that they're underserved and because of the fact that there's so many inequities that they've got to deal with each and every single day, I feel like a lot of these patients, I am their only option. And so I better do my darndest to do the best job that I can for these patients because, they deserve that. And I think it's really allowed, for myself at least, to have a lot of meaning and a lot of passion in what I do each and every day. So I think everybody sort of touched upon that aspect. And so I have to say, I completely agree with that.
So one thing that really encouraged me to stay at the University of Chicago was not only the community outreach, but our leadership and also the resources that we have at our institution. So I've had the privilege of training at 3 prominent hospitals in the Chicago area, including University of Chicago. But what was unique with my experience at University of Chicago, I remember even just from a research perspective, I remember being the nutrition fellow, and I was submitting a research project to be presented at one of the big GI conferences. And at that point, I was doing my own stats, and I don't really have any stats background. I've read some books and just kind of pieced together my own understanding. But there were a couple calculations that I was struggling with, and I was trying to see how to make my project better. And we have a stats clinic here. So as a fellow, as a trainee, I just went to the statistician and they helped me out tremendously. That never happened at any institution I ever trained at, with the exception of this one. And from a leadership perspective, like everyone said, our institution does focus on community outreach and social determinants of health. But unlike other institutions, the caliber of leadership that we have kind of guiding the community outreach arm of the hospital is amazing. So we have the Urban Health Initiative, and I believe the first leader of the Urban Health Initiative was Michelle Obama. Michelle Obama herself was a part of our institution. And then after she left and went on to bigger and better things, my mentor, Eric Whitaker, who was the director of Illinois Department of Public Health, took over the Urban Health Initiative. So when I saw that our institution is recruiting that level of people to actually reach out to the community and care for the community, I knew that this would be a place where my passion and my interest in doing community outreach would be supported.
Thanks, Ed. I guess, to piggyback off that, I guess the follow-up question I'll have for you all is how have you been able to use the resources at the University of Chicago to sort of leverage your career in any way, shape, or form? Does anybody want to comment on that? Because I think we've touched upon that. but I'd be curious to hear from the panelists about that.
Well, you know, for me, one obvious example, the Urban Health Initiative has sponsored, for me at least, maybe $200,000 worth of community outreach grants, community benefit grants. So I've had the ability to partner with a lot of local community organizations and, you know, really help provide nutrition education to our surrounding community. But a lot of that was jump-started with pilot funds through the University of Chicago. And in some of these activities that I've been doing, you know, we're actually feeding people. So it's not just providing education, but through one grant through the university, we're able to provide food for a food insecure population and also the nutrition education. And, you know, at the other institutions which I train, I didn't hear of the hospital actually supporting those endeavors.
Sources here, not only for the kind of community outreach that we do. I think, Dario, you may have mentioned this as well, about how we've got a ton of professional schools as well too that are here. Business school, you know, we've got, you know, law school. The Graham School has a number of graduate programs that, you know, rival some of the best in the country. I mean, the Booth School of Business is one of the top countries in one of the top in the country. Just out of curiosity, how have you know, the panelists been able to engage with some of the higher educational resources that are right down the street from us at this hospital?
You know, when I came as a fellow, my first year, I got a master's in science through the Public Health Studies Department. And they really tailored a curriculum for house staff that made it manageable to complete a fellowship and complete a degree. And I think another great example is a lot of residents participate in a program called Merits. I don't know if someone else here has actually done it and speak more to it, but I know a lot of our residents have participated in this formal medical education training program while being a resident.
I can say a couple words on Merits. I've not officially done Merits because there's a faculty level program and trainee level program. But the Merits Medical Education, Research, Innovation, Teaching, and Scholarship program has a participation at the resident level where people will decide that they will apply late in their intern year. And so it's incorporated into the second and third year curriculum, and it's really throughout all specialties. It's a program where, in addition to being taught medical education principles, you have a mentored project. They've let me be sort of like an emeritus a mentor. So I've mentored one of our previous residents in a medical education project. So it's a wonderful opportunity, and there are many others where it extends from the trainee through the faculty level, you know, adapted obviously for sort of the schedule and kind of bandwidth for each of those different stages.
And I can talk about a little bit specifically about one of those programs that I'll plan to do during the summer. It's called the SPORT program. It's a summer program in outcomes research training. And it really, from what it sounds like, it's really kind of an intensive summer course over, I think, 2 months, where you learn about how to do outcomes research, epidemiology, kind of learning a little bit about biostats without really being the only one expected to do your own statistics. But it sounds great. From our program specifically, it's something that is paid for. So I think the Department of Medicine covers like half of the cost, and then my program covers the other half, and it's totally protected time that I, as a fellow, won't have like continuity clinic during that time. So it's really like I'm just going to be in school for those 2 months, which sounds kind of at a stage where you kind of, after finishing first year, you feel like you almost need a little bit of a break to really get the training that you need in order for what you want to get the skills that you need for your academic career, which sounds great to me.
For those of us or panelists that are, participants that have joined in on this discussion, we're just talking about some of the resources that the University of Chicago has to offer beyond just, a residency and or clinical position as an attending, and how, some of us at the University of Chicago have been able to leverage those and use those resources to further our careers. I know another popular, really popular option that we have at least 1 to 2 residents from my department of anesthesia. They do this, every year. There is a there's a medical ethics fellowship directed by Mark Siegler, who is, I think one of the, world scholars on ethics. It's actually a course I've been kind of flirting with myself, thinking about signing up here in the next year or so. But that is a really, it's a really powerful course with some unbelievable lectures. We've actually, in the Department of Anesthesia, because I've got an inside person that is undergoing the fellowship or is in the fellowship right now, one of our senior residents, and she sends me speakers along the way. And I say, great, because we're going to steal this speaker and give it grand rounds for anesthesia for us. And they've been phenomenal. I mean, we just had Marshall Chin give us grand rounds on, his research on ethics. And it's, oh yes, there it is. Thank you, Megan. The McLean Center of Clinical Medical Ethics Fellowship, which is in the chat. And Marshall Chin's talk was just completely blew me away in terms of, the work that he's done and really how he's been able to become just a leading expert in disparities and related. And we have these world leading experts right at our fingertips. I don't know if anybody has gotten an opportunity to meet or chat or do research with him or other like-minded folks like that, but it's that's, I think, a very, very unique opportunity that we have here at the University of Chicago.
Yeah, and in our department, which is radiation oncology, we have a year of research time, but obviously not everyone wants to do research. And so our department has been really flexible in allowing people to kind of pick and choose what they want. And so every year we have 1 or 2 people decide to get a master's through the program. And usually they end up doing the sport program, which allows you to kind of transition into the master's, which they graduate and they leave and have a master's. And what's really nice about that program is they have like a built-in statistician on their master's committee. And so throughout all their research that they're doing, they just kind of have someone that they can just easily go to. Another one of our residents is doing like, they're interested in bioinformatics. And so next year they'll be doing some bioinformatics classes and looking at kind of doing a master's program that way. I personally was interested in more kind of basic science research, and University of Chicago has been great in terms of having, world-renowned faculty, and because of that, extensive resources and machines that are that I've been able to use that probably I wouldn't have had access to otherwise.
Thank you for that, Dr. Pointer. I would say I actually did, last summer I did the course on biomedical informatics. It was actually really cool course. It was about 8 weeks and it was all online. So it made it very, very easy to do the education, to obtain a certificate, and really to learn broadly about that field. And so that was a pretty easy way to do it. And it was yeah, I highly recommend it. We do have a chat. One of our participants put in the chat. And so the question is, what ways do the programs help those that are underrepresented in medicine, particularly the medical students, facilitate fourth-year away rotations? Does anybody on the chat want to address that or take that, how their program deals with that?
Yeah, I'll take it. And some of it may have changed briefly due to COVID. So I think the university has kind of cut back on some of the away rotations, but hopefully that's going to change as more and more people are vaccinated. But prior to COVID, we had a specific array rotation for underrepresented minorities. And I, as an attending, had multiple different medical students rotate on the GI service with me when I was on. And some of the students that were fourth years when I first started as a faculty member, or when I was a little earlier in my career as a faculty member, they're now applying for fellowship. So like all these people that have rotated with me are now calling me for letters of recommendation or just to even make connections. And I've now seen some of my first core host students who've done that away rotation now matching the GI fellowship. I think what we do is with that rotation, it's not just about rotating just during that 4-week period. You also build connections and establish relationships. One of the other students who rotated with me, I wrote her a letter of recommendation for residency, and she's now I think at Columbia, and we still keep in contact because she's eventually interested in applying for GI. So I think when we do bring those away rotations back, it's definitely something that I recommend people get involved in.
Yeah, and so that program is the Diversity Visiting Clerkship Program, and the application is through the Pritzker School of Medicine, but then they kind of connect people to the different programs that they're interested in, and there is a stipend to offset the cost because we realize that leaving your home institution to do a rotation elsewhere, it is a costly endeavor, and so there is a number of spots through the Diversity Visiting Clerkship Program. I can't speak about our students here, their experience, but I know that they have a lot of support because I know who works within the Pritzker, School of Medicine to help them. But just as Dr. McDonald was saying, we have residents who came and did the DVCP program in our pediatrics department who are now residents. And for our program, I actually might meet with those individuals throughout the duration of their rotation, regardless of what section of pediatrics they're connected to. And so, very, very, feel kind of like mama bear proud on it, honestly, when they come in and join our program as residents. It's just an amazing feeling.
Thank you for that. I think it is great, Adriana. Thank you for these questions. There's another question as it relates to medical Spanish educational support. And so do any of you all either have medical Spanish support within your program or in the hospital just in general?
We definitely have adequate amount of translators. So I have the benefit of being, fairly fluent in Spanish. So, my services are sometimes utilized in GI clinic, but we definitely have a lot of translators, and we have a language support line. As far as a medical Spanish class, I don't know if specifically we have medical Spanish classes. Maybe Iris, you may know more about that than I would.
And I think, I actually think that this is a project that Dr. Monica Vila is actually, in the process of trying to organize. Dr. Monica Vila really, runs a lot of things in the medical school and actually has been a huge influence as to the curriculum, the diversity curriculum in the medical school, and then really as a recruiting powerhouse for our medical school, which is one of the most diverse in the country. Actually, the most diverse that is not historically Black college or university associated medical school. University of Chicago is the next one. And she's actually rolling out a program right now where there, I believe, is some training around this, but is looking to get people formally certified in medical Spanish to act and facilitate as translators. And these are med students and other individuals in the department. So there are people that are working on this.
And also in the medical school and for the residents, the medical students and the residents have the opportunity to rotate at Ashland Community Health, which is one of the clinics here in Chicago that focuses primarily on Latino population, or Latinx population. So for people who are interested in either gaining more Spanish speaking skills or actually utilizing the skills they already have, that is one place where those skills can be further honed and developed.
For the Department of Pediatrics, we have relationships with Erie Clinic, which and one of the Friend Family Health Center locations, which serve primarily Spanish-speaking population, and also our residents rotate at St. Anthony, which is also a hospital that serves a primarily Spanish-speaking population. Some of our residents have chosen as their independent elective, so sounds just like that, elective that the person chooses. A number of people have actually done medical Spanish immersion programs. And I know that we actually have an opportunity coming up over the next academic year for a medical Spanish program that our chief residents are working out the details for. So I actually don't know the details of it, but something that would help some residents to achieve some proficiency. But I know it will be a limited number of residents who are able to participate, at least initially.
Perfect. And what I'll do in a moment here is I'll pull my email down so that if there are other specific questions you have related to that, you've got a follow-up mechanism where you can email me, and I'll make sure that I get a more specific answer for you if that's so desired. One of the things that I was going to kind of piggyback on with a lot of these points about how we're working in the community and in the clinics, et cetera. And so I'm curious how either yourselves or your departments, how you interface with our underserved population. How exactly do you go in and get into the community and serve the community? So I'd be interested to see people's experiences with that.
Okay, well, for me, in terms of hospital supported endeavors, the hospital actually funds a radio show on WVON, which is a radio station that focuses predominantly on the African-American audience. But I'm one of the hosts of that radio show. So Dr. Naylor has been on the show. A lot of our faculty members, fellows, and trainees have been on the show. We even have our Medical Champions program for residents. Residents get support to do community outreach. And one of the ways they can do community outreach is actually coming on the radio show. For me, being interested in nutrition, the university has definitely supported a lot of my cooking demonstrations in the community, and actually have a grant with the university and a community organization called Common Threads, where we're doing cooking demonstrations at Oakwood Shores, which is a mixed income community on the south side that was the home of the former Ida B. Wells housing projects. So now they converted those to a mixed income community, but there's still a significant amount of food insecurity within that community. And through the support of the university, we can do cooking demonstrations, but also bring food to all the people that participate. Last week, I believe we fed, just last week alone, 100 families, which is huge. And that is with money supported by the university.
I can provide two examples of, so the university is very nimble, if you will, for such a big and prestigious and historic place. I'm always surprised, and I'll give you two examples in my own life. I really wanted a Spanish speaking only clinic patient population, and I'd been trying a few different ways to get that in the 15 years that I've been here. And in the most recently, I just told the department, this is something that's really missing in my life. And if I'm going to continue to have a thriving career here, I need to figure out how to make it happen. So I would like to go work in this other neighborhood once a week where it's a Spanish speaking neighborhood. And they were like, fine. And so now it's Friends and Family Center on Pulaski, which is where Rochelle's residents come. And it's like 95% Spanish speaking clinic. And now the residents come there with me every Wednesday. So it's kind of a feed forward. Another example is I wanted to have more of my career focus on transgender health. So most recently, me and a few fellow attendings came to the department and said, we want to start a transgender health program. And again, the department was 100% behind it. And I've seen that over and over again in all of the spheres of the university that I've been in. If people come with the will and the willing to invest their energy and time, then the university find a way to make it happen for faculty and house staff.
Yeah, I'm gonna mention a little bit about the same. So the University of Chicago really helps me, give me the opportunity to serve the Latino community. So right now my clinic, like 70 to maybe 80% of my patients are Hispanic. And then, so coming from a Hispanic background myself, like I feel like I can understand their needs and their priorities, and that really helps me to serve them better. And I appreciate that when my fellows or my attendings have Latino patients, they send them to my clinic. So I enjoy that a lot.
Thank you for those responses. I wanted to shift gears a little bit and just get everybody's take if anybody has got a response for this, or anybody has insight into this. I wanted to ask about issues as it's related to either race, gender, anything like that. Has the university, or have you felt like the university has been supportive of issues or things that have come up? If they are supportive, are there different groups that are around that you've actual formal groups from the university where they help to support and be a source of information or a source of help for any issues that may have arisen?
Well, I will speak on this. Well, first off, I'll highlight Dr. Romero, who I actually still own an email, so now I'm just going to turn it into here. So thank you for earlier this. I can't remember which. Yeah, I was going to say what month is this? I'm having one of those mornings. But during this academic year, I sought Dr. Romero's advice on some things related more about leveraging my role, my experience as a Black woman, and sort of making sure to best support our trainees who are members of minoritized groups. And so I'll first say that there's a lot of people who are willing to take time, not really anywhere hitting her, exact job description, but just because people here, I think, are really interested and invested in other people's success. So I first want to say, thank you, because of your specific advice, that conversation, went well, and things have gone well and moved forward. I will also say there are a number of, because our pediatric endocrine is actually part of adult endocrine, we're joint section. And so I get to participate in the diversity committees of both the Department of Medicine and the Department of Pediatrics, where I think it's an opportunity for people who are just committed to equity and diversity and inclusion come together and move forward the agenda. And agendas don't move forward unless money's attached to it, and money's attached to it. And I think, if you want to say whether or not an institution is behind something, you have to see if they've got any dollars behind it. And the University of Chicago, I'm happy to say, does. And then lastly, I want to shout out our residents who, as the world was literally on fire over the summer, started to say, how can we make sure that we are really training our trainees to be structurally competent physicians to address structural inequity and structural racism, and actually on their own started a structural competency curriculum that I had the great pleasure of being the sort of faculty attached to it, and have partnered not just with themselves, but actually with the pediatric programs throughout Chicago, because we realize that there are things that don't need to stay within four walls. And so I just want to shout out those there are many individuals who I think are really committed to forwarding justice and equity.
Yeah, just to give another example, during the summer, we hosted a conversation series dealing with race in medicine, and the dean of the university was present at every single conversation. Not only present, but partook in every single conversation. And these conversations were hosted on Zoom, and we've had hundreds of faculty members and residents and students kind of tune in. So I think that in of itself is a testament to responding what was going on in the world, especially during the summertime.
I'll give a shout out for employee resource groups. So we have affinity groups where you can meet with people with similar interests. Oh, we have an LGBTQ one, Black men in medicine, HLX, Muslim, global mothers. There's like 7 of them now, and they hold events and professional development courses.
Yeah, one of the things, particularly when COVID came through Chicago strong, and it became pretty apparent in those subsequent weeks that the people that were being most affected were disproportionately those from Black and Brown communities. I think we, as a community, really, I thought it was great to see that we as a community really came together in a powerful way, and groups just really on their own accord. Ed was in a lot of these meetings with me where a lot of the African American, Black, and even some Latinx attendings just all got together in a chat and just had informal discussions about how each of us were doing, what we wanted to do as a response to all the social unrest and all the social issues that we had seen, and really created a good, cohesive, tight knit amongst each other. I saw the same kind of things being done in the residency as well too, with our House Staff Diversity Committee. I thought that was a huge source of support, of a space where residents could just talk freely with each other about what their feelings were, about what they saw, perhaps about what they wanted to do about that. And so I really thought it was cool that as a community, we have so many different official organized platforms to help provide support, but then also we have a homegrown aspect of it where naturally we've got people that come together and form these tight, cohesive bonds. I thought that was a really cool thing to see during the whole COVID pandemic, and all the issues that happened after. We are approaching an hour here, so I want to be respectful of everybody's time here. I want to thank everybody again for taking this time out on a nice Sunday afternoon. I guess I just wanted to end it and just ask people, what do they, what's your favorite thing? I mean, Chicago is obviously a very eclectic place. It's a diverse city, one of the most diverse in the country. Has so many things to offer. So I'll pose this question out here. I mean, it's the upcoming weekend. I think Dr. Romero said it was going to be 80. I'm not going to hold you to that, but it's a nice Chicago day. What are people doing? How are you going and actively engaging with the community, or actively engaging in the city, taking advantage of our own backyard?
I'll go first. I live in a neighborhood adjacent to the hospital called Woodlawn, and it's a very tight-knit community. And as soon as it gets warm, we'll all start sitting on our porches. We'll start planning our block club. Miss Gloria, the block matriarch, will come out on the stoop and make sure all the UPS packages don't get stolen. So I love summer in Chicago. That's really one of my favorite things, the community that the warmth brings out.
Yeah, I used to live in Woodlawn also, and I mean, the community there is amazing. So I would have these barbecues where everybody in our building would just come to the barbecue, and we had a good time. And that Woodlawn community is within walking distance from the hospital. So I used to ride my bike to work all the time. And a lot of residents and trainees live in that neighborhood also.
One of my favorite things, since I've moved back, I live in like the south, like in Motor Row, which is kind of like the south part of South Loop, and it's in an interesting area because I really like. Before, when I lived here, I lived in Hyde Park, and I didn't really leave Hyde Park as an undergraduate. But now I'm actually very close to Pilsen, so I really, really love going there, not just for the food, but also just kind of feels like homey to me. And I just really like enjoy just walking around, going into little shops and little stores, going into some of the different restaurants, and kind of. And I hope to find some opportunities to engage with the community there as well.
I live in the Kenwood area, which isn't too far from the hospital. And one of the things that, we like to just kind of walk around the neighborhood. If we feel like walking a little bit further, we like to walk to the lakefront and go on the lakefront trail, which is beautiful. And like just have like little picnics in the park, which is really nice. And hopefully when things calm down a little bit, maybe we'll enjoy some of the food scenes a little bit more again.
I live in Oakland. It's like 25 minutes without traffic, or around 35 minutes with traffic from the University of Chicago. And I like it a lot because we can walk. There is a lot of green areas that we can enjoy nature, and good restaurants around, enjoying the food. I mean, right now we are ordering, picking up, but that doesn't stop us from trying different restaurants and then taking the kids to the park. And so, yeah, looking forward for the spring and summer.
Yeah, so I live in West Loop. My children attend a school called Intercultural Montessori, which we are in love with. And so we live in the West Loop to be near that. And it's the same. The neighborhood is really walkable. There are wonderful places to eat, cute little local businesses, we have 2 parks near us, one literally like 2 minutes, and the other one's maybe 7. And then we're only also like 2 miles or so away from the lake trail. In a former life, when I used to believe in exercise, I would run to there. I need to get back to it. But yeah, it's just it's a walkable city, and there's just, particularly in the summer, we stumble upon things that we didn't even know were going on. It's just, there's always so much to do.
It's funny you say that. Actually, one of the things that sold me on Chicago, as around right before I came out here for residency interviews, was the realization that Chicago actually has beaches. Like, I guess whenever I thought about Chicago, being somebody that's from Michigan and Detroit area, I just never thought like, oh, Chicago, beaches, water, like all that. And so when a friend of mine showed me, and we hung out at things like Fullerton Beach, or one of those beaches up kind of by the northern area, I remember sitting there and I was like, oh my God, like we might as well be in Miami, I mean, this it's phenomenal, huge beaches, the water is great. And so that's really one of my favorite things to do is I still, I've convinced my wife to still live close enough to Lakeshore Drive where I can still run on the path, and at least pre-COVID, run up and down the Lakeshore path, enjoy the beaches. And now that my son is 3.5, I'm able to drag him out there as well too, and he loves the sand and the water. So I'm really hoping that this summer, we can beat COVID and or at least beat it back, keep it at bay, and we can experience the beaches again. Because surprisingly enough, you don't think of it, but Chicago is some of the best beaches out there. So.
You're the first Detroiter I've ever heard say that. Like all the other Detroiters are like, Belle Isle is the best place in America.
Belle Isle's great, but it's great for different reasons. It's great for completely different reasons, and we can talk about that off the panel, offline. Well, we are just a little past 3 o'clock right now. And so again, I want to be respectful of everybody's afternoon because Chicago's a great place to be, and you all need to continue to explore it with your family and friends today. So I really want to thank everybody for taking this time out. I thought this was, just another really, really engaging discussion. And it's great to really be able to meet you all as colleagues. I truly believe at the University of Chicago, we're a family, and I have gotten that sense more and more over the past year, particularly with all the challenges that we've faced both inside and outside the university, that we really come together when it's needed and step up to the plate, which you all have done. And it's amazing hearing your personal stories. So thank you for sharing. Thank you for the candid discussion. Most importantly, thank you for your time. I can't thank you enough. So enjoy